I want to be honest. My plan is not that different from Hillary Clinton's plan or John Edwards' plan or any of the other plans. Question is, how do you move it forward? Now, I admire Senator Clinton and Bill Clinton for having tried in 1993. But they did it the wrong way. Because what they did was they went behind closed doors and they tried to come up with the plan without even including some key members of Congress, including members of their own party. And because they kept things so tight, meanwhile, the lobbyists for the insurance companies and the HMOs were out there organizing, mobilizing, raising money, and they started running those TV ads. The Clinton plan was dead on arrival because they had not enlisted the American people into the conversation. So here's how I would do it. I'll have a big table, and we will have every stakeholder in the system: doctors, nurses, hospital administrators, patients advocates, employers, labor, and I will have insurance company representatives and drug company representatives at the table. They just won't be able to buy every chair. And I will sit down at the table. I'll have the biggest chair. And I will put my plan in the center of the table. And I'll say, here's my goal: making sure everybody has coverage, improving quality, controlling costs. I think my plan does it better than anybody else's, but I welcome from everybody else ideas. Now, if the drug companies say, just as an example, you know, we can't negotiate for the cheapest available price on drugs like you asked, Mr. President, because we need all this money to put into research and development. I'll call in the health economist to ask him, is this true? But this is all going to be on C-SPAN. The American people will be watching. So it's not behind closed doors, it's open. And so the drug company or the healthcare economist will come in and he'll tell me what I know to be true, which is, yes, some of the money goes into research and development, the profits they make, but a lot of those profits are going into those TV ads. A lot of what they call research and development is going into those TV ads where, you know, people are running around in fields looking happy. You don't know what the drug is for, except for that one drug. And so the point of this exercise is that because the process is open and transparent, we will be educating and instructing the American people on the choices that we have to make to actually deliver on health care. That's where my strength comes from. That's where my allies are. That's where I place my trust, because let me tell you, that's how you move Congress. That's the counterweight to the lobbyists. You know, the ways of Washington are not that complicated. Congressmen want to get reelected. If they think the best way for them to get reelected is to side with the lobbyists, they'll side with the lobbyists. And if they're convinced that the only way for them to get reelected is to side with the people, they will side with the people. And my job is to invite the people in so that they're paying attention, and if they do, we will win every single battle that we need to win to make a better America. That's how I'm going to do it. All right.